I'm Erika Steuterman, and I'm the guardian of my 61-year-old brother Stephen. And I'd like to talk to you briefly about coordinated care options. It's really important for people with intellectual and developmental disabilities to have coordinated care. And by that I mean much more than just coordinated medical care, although that's extremely important. It's important that they have doctors who are actively involved in their entire care, but also you want to have nurse practitioners, specialists such as psychiatrists, psychologists, pharmacists, behavior specialists, job coaches, caregivers, care providers, and especially pharmacies, because I know that the pharmacy support is extremely difficult for my brother, and that's the experience that I'm speaking from. In short, everyone in the community who owns a small piece of the pie of giving my brother his health, his safety, and his happiness need to work together and coordinate to give him the best possible coordinated care options that can possibly be had. Current health and long-term care systems are not working. They're expensive and they're not very flexible. And my brother, even though he's 61 years old, his health care needs are much different than someone who is 80 years old that is experiencing Alzheimer's. My brother lived in Central State Hospital for 29 years and left in 1994 when Central State was shut down. Now I know that there are some probable health ramifications that came from living in that environment for so many years. But regardless, as he ages, any existing health problems that he has are more pronounced because of the large number of medications and the length of time that he has taken those medications. So it is vitally important that his health care and all of his care be very finely coordinated. And a case in point is that on June 15th of this year, it was discovered that my brother had deep vein thrombosis. He had a clot in one of his legs, and this is the second time that has happened. He went into the hospital on the 15th of June, stayed overnight to get started on the blood thinners, and it was at a fairly high dose that was supposed to last for 21 days. Well, on August 1st, when we had our second checkup after the hospitalization for his blood clots, we discovered that after the 21 days of the high level of blood thinners was over, he was not getting that lower dose that he was supposed to be taking for the rest of his life. I remember my brother's physician turning to me and saying, "I am deeply concerned about your brother's health and the deep vein thrombosis." And I felt terribly guilty, and I said, "Sir, I am doing the best that I absolutely can." And he understood that. But I still feel guilty, and I know that not giving him the medication as long as he was supposed to have was not something that was done maliciously. It wasn't done on purpose, but it still happened. And if he had someone who was looking at his whole coordinated care options, looking at everything about him, not only his health care, but the behaviorist, to help him with his dining plan so that he eats healthy. All these things come together to make him healthy, give him a good life, enable him to continue working in the sheltered workshop, and give him a reason to get up in the morning. Right now, we need to have a thoughtful and realistic coordinated care options. It's going to take a lot of work, but it needs to be done. It's vitally important, and it is long overdue. Thank you very much for your time.